where an individual has a reduction of movement at the wrist, we want to make sure that that movement is restored. Very often, if a person has had a fracture, for example a Colles fracture which has been immobilized, as the pain starts to ease, they will then start to do normal functional activities, and they may not notice that they've lost their end range movement to the wrist. And that can be a problem if they then fall onto the outstretched hand again and they don't have that movement, and it's forced and causes further injury. So we want to move through flexion and extension, abduction and adduction, and pronation and supination, which of course occurs at the elbow but is mimicked at the wrist. So for our flexion movement, what we're going to do is use a couch, or at home they could just use a table or a kitchen work surface. The hand is at the edge with the other hand on top, forming a little pivot here, and the action is to come down into flexion and then come up into extension. So if you just align yourself there, so that wants to come back to the edge, that's good, and go down and come back up. Now as she starts to make progress, she will need more power on the extension. So if you now stand up, you can place the whole of your body weight through that straight arm. So we're going down into flexion, and then as you come up into extension, it's really press, 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 and you end up almost in a semi-push-up position. So that's our flexion and extension. For abduction and adduction, we put the hand further into the couch, again stabilise on the edge of the wrist, and then we slide the elbow from side to side. So we are performing an action almost as though we're polishing the surface. So let's have a go. Hand is flat, and then we slide into one direction, the other direction, just draw your thumb up a fraction so that you're not blocking it, and we go around. And again, these are two movements that she can easily do at home, and you can just build them into daily activities. And then for our pronation and supination, we're going to do two actions. So we're going to draw the elbow into the side, and I'm taking a stick and I'm in the centre of the stick, so there's very little leverage. And that free movement is just pronation and supination. As I want to increase strength, I go to the end of the pole, and the lever then is very hard to pull, so I'm having to pull quite heavily to pronate and then quite heavily to supinate. So if you take hold of that, elbow tucks into the side, and all we're doing is twisting. So grip quite firmly so the hand doesn't do the movement, come right round and then in the reverse direction. That's good, and then once that movement is free, we then lengthen. So come to the end of the pole, now grip hard and lower it down, hold it, hold it, hold it, hold it, hold it, and then come back and lowering down towards this side, hold it, and then we come back again. So that's our pronation and supination done for range of motion and for strength.